Hi there, welcome back. This is Dr. Jenny Yoon. Today we're going to try to answer the question, is it safe to get pregnant after you've had breast cancer? And also we're going to look at if there are any long-term effects on the babies that are born to women who used one of the fertility techniques that we discussed last week. So what happens when one of these fertility preserving techniques are used to preserve fertility and the breast cancer survivor is pregnant? Let's look at some of the data regarding possible risk to the fetus and children conceived this way. Current research indicates that the children of cancer survivors are not more likely to have birth defects or chromosomal abnormalities, although the data is limited. In addition, these children do not have higher rate of cancer development as one might expect. What's important is that you keep in mind that many of the fertility preserving techniques that we discussed last week are fairly new, and there's not much available data regarding their safety and long-term effects. However, the data that is available show little evidence that there is increased risk of birth defects or developmental problems in these children. However, these survivors are at increased risk of having multiple births, like twin pregnancies and triplets and so forth. And there's also risk of having premature babies, babies that are low birth weight, increased risk of miscarriages and infant death in women, even when only one of the fetuses, one fetus is conceived during using these techniques. In addition, pregnancy in these women will aggravate organ damage that may have been caused by cancer treatment. As you know, some of the chemotherapy drugs or radiation to the chest and other types of treatment that are used may damage the cardiovascular system. And the demands on these structures during pregnancy can aggravate whatever the condition is that were caused by the treatment, and that can be dangerous to the mother and the fetus. So it's important, if you're a breast cancer survivor and you're thinking about getting pregnant, that you realize that there are these increased risks that are related to your treatment, and you need to be cared for by a specialist who can manage and monitor to make sure that you can progress with your pregnancy safely, not only for you but also for your baby. And another concern that cancer survivors have is whether if you get pregnant, all the hormonal changes that occur in the body will increase your risk of having another breast cancer. The data on that is limited, and there's a lot of controversy regarding pregnancy and recommending pregnancy in women who've had breast cancer. However, current studies indicate that the risk of recurrence or developing another breast cancer is not increased in these women who do get pregnant, and the survival rate is not diminished with pregnancy. In addition, the data suggests that these fertility preserving options do not decrease the success rate of cancer treatment if the cancers do come back. However, it's important that you keep in mind the data is limited on this, and whether or not you should or should not bear children after your breast cancer treatment needs to be decided after talking to your doctor and seeing a fertility specialist, and make a decision that is suited best for you and your family. The optimal timing people ask is, when is it best time for me to get pregnant if I'm a breast cancer survivor and I want to have children? Well, most studies indicate that you wait about 2 to 5 years after treatment, because this is a time when your breast cancer tends to come back or recur. So if you wait 2 to 5 years and you're still cancer free, then most people think that it's safe for you to get pregnant. Again, preparation is the key. Know your facts, your risks about getting pregnant. Don't put yourself and your baby at risk by getting pregnant if the pregnancy is not right for you. This is Dr. Jenny Yoon. See you next week.